I'm Coach Steve Hancock, and I had both knees replaced at Skaggs. I'm a football coach, and I've also been an activities director at Branson High School. This will be my 27th year at Branson. This will be my 41st year of coaching. I've had knee problems for several years, and I've had 3 scopes. I was at the point where I knew I had to do something to continue my career and to change the quality of my life. You know, it got to be the point where I didn't want to walk very far.
Coach was having a lot of pain in his knee, and he wasn't really sure what was going on. But after we'd taken some x-rays, we showed that he had significant arthritis in both of his knees.
And the first thing he says, I'm glad that those aren't my knees. It was basically bone on bone. My cartilage had gone, and he just said, they're ready. We need a replacement whenever you're ready.
He has to keep up with those young kids at times. He has to do activities that your average total knee doesn't have to do. But as a coach, we had to get a lot of good muscle balancing, a lot of good soft tissue balancing to where he could keep up with those young kids.
I like to do things in the hometown as much as possible. I did research on Dr. Huffman, and he does a lot of knee replacements, and he's had great experience, great success, and also did some research on Skaggs Hospital, and I know that they're one of the best around as far as infections go, that they've got the lowest infection rate of hospitals around the area. I felt real good about that, and I'm really glad I made that choice.
A couple years back, we started out with the Marshall Steele program, which is a program that was developed to encourage these patients to get better faster.
We had a class we went to, and they got to answer some questions. It told us some things to look forward to. The book that we got was very instrumental. Told you exercises to do before you went to have your surgery. It also gave you a time span of what you can expect, what's going to happen after 1 week, what you can do after 2 weeks, and so it's very beneficial.
Well, I think with the Marshall Steele programs, we motivate patients better than they do just to lay in bed. We have them get together. They do their therapy together. They have their lunches together. They have people that's there to encourage them. They have their coaches sitting right beside them say, yeah, do a little bit more. And they do great. They do marvelous.
My first mate was my wife, Marty. And of course, your first mate is very important in the process, and especially that first 2 or 3 or 4 days, they have to do a lot for you. But I told her I was going to have a bell and ring it whenever I wanted something, but that didn't work. So, but everything went fine, and she was a great help. I felt very comfortable. You have a private room, which is very nice. You have your first mate there with you, and they can spend the night if they want to. The nurses were great. Everybody, the whole staff, as far as the doctor staff and the hospital staff, great. They get you up very quickly. Got up in a chair, and then we walked. We had surgery one day, the next day we walked and started doing rehab in the rehab room. So they get you active quickly, which I think is very important. And you'd be surprised at how well you can get around right after surgery. I was very surprised. They create a competition, and being a coach, competition's good, and it gives you something to compete with the other patients that are in the same situation that you're in. You do laps, and when you do laps, you get to move a ball. It's a good motivation to help you get through the 2 or 3 days in the hospital for your rehab and for your getting yourself ready to go home.
He walked out of our hospital the second day after surgery doing great. And so his first day back in my clinic to remove his stitches, he said, when can we do the other one?
I was very fortunate that I got to do the outpatient rehab at Skaggs Medical Center. I felt like that was a big part of my recovery, was the stuff that I did in rehab.
Well, the coaches are just amazing. I mean, even after the second knee, he was out of the hospital on day 2. He's back to coaching. He sent me a nice little card, says thanks for extending my career. He has virtually no pain now. He can ambulate. His legs are no longer bow-legged, and he's doing quite well.
My knees feel very, very good right now. It's a good feeling, it really is, to go out and practice and feel good again and, have more energy again. I feel like my quality of life is much better than what it was, and getting better all the time. I went to Silver Dollar City last Sunday and walked up and down the hills and didn't have any pain, and it's been many years since I've been able to do that.
I see patients in my office that are in pain and they're afraid to have this surgery. And you can't blame them, it's a very serious surgery. But yet, 97% chance that you're going to do great after this surgery. Why put it off and undergo those many years of pain that you have to look forward to when you can get back to a relatively normal life?
My brother-in-law, who lives in Kansas City, I talked to him. He's had a knee replacement. He went to Columbia to get his done, and he said, well, you got to come to this Kansas City or you got to come to Columbia. you get something done like that, you need to go to a big city. I researched it, and I thought this was the best place that I could have it done. Just the other day, we was at practice, and one of the football players noticed that I was jogging from one drill to the next. I haven't done that for several years, and they said that motivates me, and so if that motivates the kids, that motivates me too. I feel like I can do just about anything that I want to do now.